Hello and welcome to Challenge channel.
In this video, I will show you easy and simple way to conduct examination of lump by using mnemonics. So, whenever you see a mass in your exam station, you should apply this mnemonic to examine it. The mnemonic is 5S, 2T, SE, 3Cs, and M. So, we will start by examination of the lump or swelling, but before we start this section, I want to mention key principles in any clinical examination. The first principle is that in any clinical examination, we start by wide mnemonics. In these mnemonics, W stands for wash your hand, I stands for introduce yourself, P stands for position and permission. I mean by that, you should take a permission from the patient and put the patient in appropriate position for a certain examination. E stands for exposure. The second principle in any clinical examination, you should come in the right side of the patient. The third principle in any clinical examination, before you put your hand in the patient to do a palpation, you should ask the patient about the pain and you should ask him if he has any pain in the area that you want to examine. The last principle in any clinical examination, when you finish your examination, you should thank the patient and cover him. If you apply these 4 principles in any clinical examination, you can get at least 4 points in the checklist of the exam. So let's go back to the lump examination. The meaning of lump is swelling. This swelling can be in any part of your body. It can be in your hand, head, back, neck, abdomen, or in any area in your body. This mnemonic actually stands for the following. The first part is 5S. So, the first S stands for site of the swelling. The second S stands for size of the swelling. The third S stands for the shape of the swelling. The fourth S stands for skin over the swelling. And the last S stands for the scar. The next part of mnemonic is 2 T's. The first T stands for temperature and the second T stands for tenderness. The next section is composed of SE. S stands for surface and E stands for edge of the swelling. The next section of the mnemonic is composed of 3 C's. The first C stands for consistency. The second C stands for compressibility, and the last C stands for composition. The last section of mnemonic is M, which stands for mobility. So, let's explain this mnemonic in more details. Let's take an example of case scenario that most frequently show up in your exam. The case scenario is that this patient presents with swelling in his wrist. Please examine him. So, in your exam, in order to get full mark, you should apply the previously mentioned 4 principles. Okay, let's start. First of all, you should apply the first principle in any clinical examination, which is abbreviated in wide mnemonics. The next step, we come to inspection. We say a certain things inspection by using 5S mnemonics, in which the first S stands for site of the swelling. You should describe the anatomical site. And the second S stands for size of the swelling. You should say approximate size. So you can say this lump is about 2 by 2 centimeter in diameter or 2 by 3 centimeter in diameter. You need to say an approximate size. The third S stands for the shape of the swelling. It can be rounded, it can be spherical, it can be oval, it can be any shape. You should describe what you see. The fourth S stands for skin over the swelling. So you should look for any discharge in the skin or for any dilated vein or visible pulsation or pigmentations. So the mnemonic for these is 2 D's and 2 B's. 2 D's stand for discharge and dilated veins. 2 B's stand for pulsation and pigmentation. Finally, you should look at the scars, either present or absent over the swelling. Then we come to palpation. We apply the following mnemonics, which is 2 T's, SE, 3 C's, and M. So the first T stands for tenderness. We press on the lump and looking for tenderness. You should look here at the face of the patient. Temperature, the second T stands for temperature. SE, S stands for surface. It can be smooth or irregular. And if it's irregular, it can be either nodular or lobulated surface. E stands for edge. The edge can be either well-defined edges or ill-defined edges. C stands for consistency. It can be soft in consistency or firm or hard in consistency. So in your exam, it's always safe to say it's a firm in consistency. If you are not sure about consistency, you can say a firm inconsistency. C stands for compressibility. And there is a rule here. Any lump which is compressible, this is a vascular lump. C stands for composition. We need to know if it's cystic or a solid swelling. We know if it's cystic or solid swelling, we do a cross fluctuation test. And we say the lump is cystic when the test is positive in 2 axes. M stands for mobility. In this section, we need to know if the lump is fixed to skin or underlying muscle or fixed to both of them. So we know the lump if it's fixed to skin or not by trying to pinch the skin over it. If we are able to pinch the skin over it, this means this lump is not attached to skin. And we know the lump if it's attached to muscle or not by putting underlying muscle in action and trying to move the lump. If we are able to move the lump, this means the lump is not attached to muscle. And if you are not able, this means the lump is fixed to the underlying muscle. So, in this part, you should tell your examiner one of the following comments. The first comment, as you say, this lump is freely mobile. This means lump is not attached to the skin or underlying muscle. The second comment, it can be the lump has a limited mobility if it's attached to the skin or muscle, but not both of them. And the third comment, the lump is fixed. And we say that if the lump is attached to skin and muscle. I mean by that, attached to both of them. Also, we can do a special test in certain lump, like a transillumination test, which is done in any cystic swelling like a ganglion. We complete our examination by examining proximal lymph node and distal pulsation. Finally, we thank the patient and cover him. By applying these mnemonics, which is 5S, 2 T's, SE, 3 C's, and M, you will get 7 or 8 marks out of 10 in your exam. The rest of 2 or 3 marks, they are distributed in diagnosis and management of the lump. So, how to reach the correct diagnosis of any lump? Well, any lump has a special character which differentiates it from other one. I will mention a special character of each lump that commonly come in your exam. The first lump that commonly show up in your exam is lipoma. Lipoma found in the back and has following unique character, which are: it has a lobulated surface, slippery edges, soft in consistency, and not attached to skin. The second lump is a sebaceous cyst. It's commonly found in a hairy area like a face and axilla. The special character of it has a punctum, and it's attached to skin and cross fluctuation test is positive. The third lump is a ganglion. The common site of this swelling is the hand and wrist. It has a smooth surface and it's a fluctuant, and when we do a transillumination test, it will be positive. The fourth lump is dermoid cyst. This lump diagnosed by its site. It can be found in the angle of eye or mouth, and in this case it's called external angular dermoid cyst. Also, it can be found in the neck, and in this case It's called midline dermatitis. The last swelling that comes in your exam is a parotid swelling. This is swelling found in the angle of the mandible, which elevates ear lobule upward and backward.
That's it for today's lesson. If you have any questions, please let me know. Thanks for watching. Don't forget to like this video and subscribe to our channel in order to get more and more free videos on the time of production.